By now, our two patients have completed their last-minute checkups with their doctors. They've talked over what will happen and what they can expect, and headed into surgery. One of the surgeons who is performing the operation on our two patients today is Dr. John Coon of the Morrow Institute.
The literature shows that the band produces slower weight loss than the bypass, but interestingly enough, the gastric bypass at years 3 and 4, people begin to show some weight gain again. Some of them a modest amount of weight gain, whereas with the gastric adjustable band, the weight loss was slower, but it was more persistent and it tended to level off, and there wasn't the weight gain that one saw with the bypass. Now, the people that have a band don't lose, I think, quite as much weight on the average. It also, I think, has a place for people that just didn't want to have their insides rearranged as much as a bypass does to them. And I think there's also a, what shall I say, an advantage for people that don't want to take such a big leap, but yet really ought to because they have the indications. They're heavy enough, they have other diseases that are caused by their obesity, and they really ought to have something done. And the lap band has been just like I hoped it would be. Typically, you tell people to expect about 1 to 2 pounds of weight loss per week, just kind of regularly every week. They very seldom will ever lose 5 pounds in any one week, but they will lose 1 or 2 in a week, and that's been my experience in my patients that they've lost in that range. At that rate, one can expect a patient to lose 50 to 100 pounds a year. The lap band operation takes probably about an hour or so to do. Immediately following operation, before the patient goes home, on that same day typically, we want to be sure that the band is in good position, and an x-ray will tell us that. The other thing we want to know is, can the patient swallow? Will fluid go through the band? Is the band around the stomach too tight, and has it squeezed them up? And if it is too tight, then of course we want to know that right away. And what we do is give them a swallow of material we can see on x-ray, and we watch it go down their esophagus, down their stomach, and if it goes right on past the band into their stomach, we know everything is good and they can go home. But some people anatomically require more time than others, but post-operatively, a lot of patients will go home that same day, later in the afternoon, early evening. One of the things about the band is it goes on longer. Its effect goes on longer. And people will still be losing weight at 36 and 40 months after surgery, as opposed to a bypass where at 12 months after surgery, they've pretty well maxed out their weight loss.
Lauren Kornberg is a Morrow lap band patient who was back at work very soon after surgery and beginning to lose weight.
Tomorrow, Monday, will be 5 weeks since the surgery. On my 10-day visit, I had lost 14 pounds, and I haven't weighed myself. I have another visit in 2 weeks. I am estimating I've lost about 20 pounds. I'm down about a size, a clothing size. And I feel really good. I took a week off from work. I was home that same day by about 2 o'clock. Was uncomfortable for about the first day and a half, but not unbearable. And was out and about by Friday and back to work at a physical job the following Monday. I run a pet care company, dog walking, house sitting, so I walked, a week later I walked, I think 11 dogs or 15 dogs a week away out of surgery, so big dogs. I'm 31 and I decided that this would be a good time to do it. I've tried to lose weight in the past. I wasn't really heavy when I was younger. I started gaining weight after high school and college. I was diagnosed with a thyroid condition about 2 years ago and tried to lose weight when I was on the medication, and nothing ever budged. And it just never went anywhere, and if I did lose 20 or 30 pounds, it would creep right back on again. And I didn't want to continue yo-yoing for the rest of my life. I figured that this was a tool to help me, but not the fix, so I threw out everything in the refrigerator and the cupboards and have overhauled everything. You know, no fried food, no processed foods. I like to cook and have been preparing everything, fresh foods, and packing my lunch every single day. I've been pretty meticulous about maintaining what I eat every day. I had no health problems, so that was ironically part of the reason. I have no heart disease, I don't have high cholesterol, I don't have high blood pressure, but I'm going to. And so I figured I was better off doing it now when I was healthy, as opposed to waiting till I had complications from being overweight and then trying to make myself better.
Because there's no tremendous cutting of the muscle fibers, there's no risk for herniation, and those people actually could go back to work doing heavy labor the next day after surgery. They wouldn't like it, it'd hurt, they'd be sore, they'd be low on energy, they wouldn't get much done, but they could do so safely. And so that's the reason we tell them to take a week off, so when they go back to work, they're not quite so sore. If they have a heavy job to do, maybe 2 weeks, something like that. The advantage of a laparoscopic approach is they have some little holes here and there that are covered up with tape strips or whatever. And about a month after the original operation, then patients will come in for their first adjustment. These adjustments occur based on various symptoms the patient tells us. And the purpose of an adjustment is to squeeze the band more and more and more, or relax it perhaps if we squeezed it too much, in an effort to get it just right so the patient can eat food just the right amount so they get that 1 to 2 pounds a week weight loss.